Hey, it's Dr. Tait again, Functional Medicine Regenerative Medicine Specialist here in Tucson, Arizona. And we had a great question follow up on a video that I did before because I was outlining a lot of what I do. I spent the last 15 years working towards building a framework that we can help people really recover their health when it relates to pain, right? It's a big focus of what I do in my practice. We take people through some steps to help their body repair rather than just masking the symptoms with medications, shots, burning nerves, all these other very invasive type of procedures. Instead, we harness the healing potential of the body to help the body recover, repair, regenerate, and see those symptoms gradually fade away. So we get away from symptom-based treatments, we move to system-based treatments to get the systems optimized in the body to help it heal. But the question I had from somebody that watched the video and they sent it to me and they said, great, I don't have osteoarthritis, I don't have arthritic knee joints. What I have is a sense of just not feeling my best. I don't feel vital anymore. I don't have this vitality that I used to. I get tired easily, I'm fatigued, I don't sleep well, I'm gaining weight. All these different factors have been evaluated for this particular patient elsewhere, and they had the conventional labs done. They were said, or basically they were told, after looking at those, there's no big things wrong here, so that's fantastic, but this person doesn't feel well, right? They know something is wrong, but the labs that they got are not showing the answer. So how do we dive into that with a patient that feels, hey, something's wrong with me, I need to figure it out, I'm willing to put in the work to figure it out, I want to recapture my health, I'm going to reprioritize what I need to, I just need some direction, right? I need a guide to take me from step 1 to step 5, whatever and however many steps we need to get from here to there. But again, I'll take it back to this analogy. When we look at our ProMed process, it still is these 3 steps. So it doesn't matter if I'm seeing you with an arthritic knee, back pain, fatigue, gut health that's subpar, weight gain. We can put it through the same framework that we've developed because the foundation needs to be set regardless of what issue we're treating with the patient. I almost said symptom, but we want to really get to the issue with the patient, not just the symptom, right? We will focus on that in the early stage. We will try to get some symptomatic improvement, put some tools into place that will help the symptoms go away while we're building a long-term plan for that patient. Because again, we don't want to hang out here at base camp, right? If we do a lot of work, we go out on an expedition, nobody wants to sit around in the tent and watch everybody else climb to the top of the summit. We want to be on that journey, but the journey is going to be individual for each of us, right? The preparatory work that we do is going to be individual for each of us. And if we put it through this process, we can find out what are those necessary steps, what did we not uncover with some of those labs that were done elsewhere, or testing that really didn't give you the answer, because I know these are the patients that I've seen over the past 5 years in my practice. They don't feel well, but everybody's telling them there's nothing wrong with you. Just get about your life, or it's aging. Even worse when I hear that. Oh, it's part of aging. You're just going to feel worse, and you're not going to be as vital. You're going to gain weight and get fat like the rest of the United States. Well, that's not true, right? It is very true looking at our numbers, and we see the direction people are going in the United States and how much effort we're spending on managing these chronic diseases rather than giving the patient control back, right? Because I believe patients can and will shape their health destiny based on the steps, based on the effort they're putting into it, and having a strategic plan. But if you're not an expert in this realm, right? If you didn't go to school for 15 years and practice and see thousands of patient hours to come up with these treatment plans, and you're scouring the internet and you're getting all kinds of misinformation, how do you put it all together, set a foundation so your body can get back on track and get where you want to be? Not sitting down here, out of life, but back in life doing the things that you want to be doing.